Hello and welcome to AgeWise Health. I'm your host, Maggie Jess, Director of Nursing at AmeriStaff Nursing Services. On today's show about sexual health and wellness, I'm going to talk to a panel of nurses, not just one guest, 3 guests, with extensive knowledge about sexual health and wellness and aesthetic procedures. I'm joined today by Courtney Cook, Madison Wagberg, and Melia Kramer. Thank you, ladies.
Thanks for having us.
Oh, yeah, our pleasure. So, if you could quickly just kind of go around your background and tell us how you got here today.
Sure. So, I had my master's degree at Oakland University. So, I'm a certified nurse practitioner in family. And during my time when I was actually training at Beaumont Hospital in the PACU, or the post-procedure care unit, I was introduced to many urologists there. So, urology became a passion of mine. So fast forward to where we're at today. I've been with the Michigan Institute of Urology for 8 years, and during that time I actually opened my own medical spa. It was called Moxie in Clawson, and we did procedures such as aesthetics, so Botox, dermal filler, but we also did sexual wellness procedures to help with penile and vaginal rejuvenation. So this year I had the privilege of joining forces with the Michigan Institute of Urology in building a new branded business called Redeem, which we'll talk about in a little bit, but that's where I'm at today.
Wonderful. Thank you, Courtney.
Yes, of course.
Yeah. And my name is Maddie. My background consists of a degree in human biology and nursing from Michigan State University and Valparaiso University. I began my nursing career at Beaumont and Royal Oak on a medical surgical unit. From there, I started dabbling into the world of aesthetics, getting into laser hair removal, which is kind of where I crossed paths with Courtney, and she kind of scooped me up, and I fell in love with urology, and we've been a great team ever since.
Yeah, that's great. Wonderful. Malia?
So I'm Leah. I actually am a newbie at Redeem.
We love newbies.
Yes, so I'm the women's health specialist. My background's actually an aesthetic injector. My background's actually, I have 1 bachelor's in nutrition, and then I got my bachelor in nursing from Wayne State, and then I've always had a passion for women's health, and so I got my master's of nursing in midwifery at University of Michigan. And when I was in school, I saw a real gap as treating patients in hormone imbalances and really just overall wellness. We're really good at putting out fires, great at birth, which is so important and so awesome, but there's a real gap in perimenopause or, I'm just not feeling quite right. I'm really tired. My hair's falling out. I had nothing to tell people. And so I started really researching and training, and somehow through a friend, Courtney and I connected, and I had done aesthetics a little bit here and there, and I wanted to kind of get back in, and we started talking, and there were some opportunities at Redeem.
She's here.
Yeah, this is so great.
I'm here running my mouth.
Wonderful.
So that's kind of how it happened.
Well, thank you, ladies. I mean, you've got it covered from A to Z, so that's wonderful. And so, let's talk about Redeem.
Yep.
How did that start? What do you guys do there?
So as I mentioned, I did have my own medical spa before, and we kind of incorporated a lot of what we did there into Redeem. Okay. So we do, the aesthetics, so Botox, dermal fillers, Sculptra for collagen reproduction. We do a laser called Morpheus 8, which is radio frequency microneedling, help tighten tissues, rebuild collagen. And then we also do PRP, so platelet-rich plasma, which you'll hear us talk about a little bit later, for rejuvenation of the hair follicles, so to help grow hair.
Okay.
So setting aesthetics aside, we also do sexual wellness procedures. Mm-hmm. So for penile rejuvenation, we offer the Duolith, which Maddie is actually going to touch base on in a few minutes.
Okay.
It helps, basically all of our procedures help rebuild blood flow and rebuild blood vessels, blood flow, nerves, which enable, better erections, better orgasms and such.
Okay.
Also increases sensitivity and whatnot too. So for men, that's one thing. We do the PRP shot or the P shot, platelet-rich plasma. Mm-hmm. Your blood is drawn, it's spun in a machine, and then it's actually re-injected into certain parts of the penis. And then,
Okay.
I know some may.
Does it hurt?
We do local numbing, so it's very, very tolerable procedure.
Okay.
For all of our patients that we've had.
Well, that's good.
Yes,
yeah.
So a lot of people hearing needles down there, they're just kind of a little standoffish, but everyone has tolerated it very well. And then another procedure we do for men is it's Botox in the penis. There's a couple different studies out that show that blood vessels are actually surrounded by muscle, like a smooth muscle. So when Botox is actually injected into the penis, it actually relaxes the smooth muscle, allowing for more blood flow to come. More blood flow equals better erections. So it's quite interesting, the technology out there, and I don't know who actually injected themselves
that out,
first
right.
with that, but
Well, they use Botox for a lot of other things.
They do, a lot.
It's not just for your forehead.
Correct,
Absolutely.
yes. So that's the men's side. Women's side, we do a lot of vaginal rejuvenation. So same thing with the PRP, the platelet-rich plasma. We do the O shot or the orgasm shot for women. There's an injection of PRP into the anterior vagina or the G-spot. And this helps recreate collagen and recreates, your body to promote more lubrication down there as well.
Oh, okay.
It also, there is an injection near the clitoris too, which actually stimulates more blood flow to cause better erections.
Okay.
Erections, excuse me, orgasms. Jeez.
There's a little bit. I can see where we're going with that.
Yeah.
And then we offer 2 vaginal devices. One is a Mona Lisa Touch. The Mona Lisa Touch are geared toward our menopausal women that have a lot of vaginal atrophy. So they're having postmenopausal symptoms such as dryness, painful sex, low libido, decreased sensitivity. So the Mona Lisa Touch is actually a CO2 ablative laser. So it's actually ablating the inner lining of the vaginal canal, and your body's kind of saying hey, what's going on? I'm going to try to regrow some of this tissue, regrow some of that collagen down there.
Okay.
By doing that, the treatments have shown great results with increased lubrication, decreased tearing during sex, and all the other symptoms. And then we have the Votiva, which is heat. So it's actually radio frequency, which is heat, in the intervaginal canal that helps tighten that tissue. So my moms that had just had babies, this is for you. This one is, it actually helps a lot with incontinence. So if you're coughing, sneezing, laughing, you're having that stress incontinence, and you're actually leaking, that one's for you.
Okay.
So we have them geared toward.
You have a wide range. It's not just postmenopausal, menopausal. It's pre, during,
we
and
literally
post.
range from 18 is when you can first do things to in their 70s, 80s,
even 90s.
We've had too. So it's quite interesting. Yeah.
That is very interesting.
Yes.
That is a huge range then. So you are literally marketing to everyone.
Correct.
Yeah.
Everyone. Yep.
Well, that's wonderful. Good to know.
Yeah.
So, Maddie, this question is going to be for you. So, what is ED? What does it stand for? What is it? And how do you treat it?
So ED stands for erectile dysfunction. This is a condition in which someone might have a hard time achieving an erection and or maintaining an erection that's sufficient enough for sexual activity. A common treatment process for ED kind of starts with medications such as Viagra or Cialis. But, a lot of times we get a lot of patients coming in saying, I've been taking this for a while and maybe it's not working as well as it used to for me. So kind of like we touched on earlier, one of the treatment options that we talk about is Duolith for erectile dysfunction. That utilizes sound wave technology. So it's a low-intensity shockwave therapy. So what happens is the sound waves penetrate the skin. They work at the cellular level within the penis itself. They actually cause the cells to expand and contract as those sound waves pass through. When that happens, it tricks our body into thinking that there's some sort of injury happening at the site. So when we have that, it triggers this healing response in our body. So we get an influx of all of these healing properties to that area of the so-called injury, even though there's no actual injury. So with that, we see the formation of new blood vessels. We see that reestablishment of old blood vessels that may not be really filling up to their full potential like they once were. And we can also see the regeneration of nerve pathways as well, so helping to heighten sensitivity. So all in all, we're increasing blood flow and heightening sensitivity, helping to achieve and maintain those erections.
And from Michigan Institute of Urology, getting that clientele in, we're seeing gentlemen come in that have nothing. They've been through everything, prostate cancer, they've been through other different injections, they've been through it all. And they're not even able to obtain an erection. So when they leave us, we're able to give them something. They are able to feel something again, which is everything to them, which is great.
Absolutely. Yeah. With the Duolith, am I saying that correctly?
Correct.
Okay, so I assume everyone's different. So would the first visit and treatment work on someone? Possibly. How long does this take?
So that's a great question. This healing process that unfolds in our body, sometimes it can be a little bit delayed. I always kind of compare it to like if you break a bone. You're not going to wake up in the morning and be completely healed, right? We got to give our body time to let that healing process unfold. So on average, we get a lot of feedback from our men, and we actually do a lot of studies on their results as well. So on average, we see around treatment number 3 or 4 is when men really start to see an improvement in their symptoms. And with that being said, even after their last treatment, which is treatment number 6, it's always a series of 6 treatments. So even after that last treatment, for up to 2 months, we still see improvement in symptoms just because that healing process is still unfolding.
Wow. So it could take even longer than that.
Yeah.
For an individual.
Yeah.
All right, great. So we've touched on some of the sexual wellness stuff, and then you guys also do aesthetic procedures?
Yep.
Okay, so for a layman like myself, what's that mean?
So aesthetics is basically, we offer injectables to help kind of revamp your, facial structures, like decrease the lines in your face, stop some muscle movement that are causing the lines. So we kind of help to try to balance the overall appearance of your face. There are multiple procedures out there. If you Google, there's probably thousands, but the ones I had mentioned that we offer are, Botox or Dysport. Those are basically meant to relax your muscle movement. So the more contractions you have with your muscles, the deeper lines that you may have or may form, over time. So by decreasing some of that muscle movement, you're not going to have those deeper lines. You may still have fine lines, here and there, but in general, it'll kind of like lessen the appearance of those lines. Dermal fillers are usually used to help restore volume. So if we're thinking of, why is this looking like this? Why are these lines looking like this? We kind of focus in the mid-face, saying what's going on. As we age, we continue to lose collagen, starting around like late 20s, even early 30s. So you're maxed out at your collagen, and at that point, everything just starts to like dwindle away. So with that being said, everything in your face just wants to fall. There's no, nothing's kind of holding it up. So when we do look at the mid-face, we actually want to inject, starting in the mid-face, we call it the bra of the face, just to help to maintain and help to support all your structures. So without that support, if you were to fill certain areas of the face in general, you may not be fixing the problem. So you have to go to
The source.
Figure out the source first and then kind of tweak from there.
And you guys come in because you find the source.
Correct.
Right.
I don't need to know the source before. You're going to tell me where it is.
We'll tell you where it is.
There's some
yes.
bony resorption that happens with aging too, especially around the eyes, or the zygomatic and the mandibular angle can kind of lessen. And so sometimes using filler to just add some of that volume back there. It makes a difference without changing your face. I think when it first started, people would just fill the lines, and we don't.
Well, that's what everyone thinks about aesthetics. They think it's like blown out lips, blown out cheeks, blown out. That's not what we do. We're more the natural approach, and even a better product out there too is Sculptra. So Sculptra is just a liquid substance. It's injected in certain areas of the skin, and what it does, it helps promote your own collagen to regrow. So back in the day, it was actually introduced to AIDS patients because they had a very gaunt look. So when they used this on their face, it helped them reproduce their own collagen, so they didn't look so gaunt. So basically, if people are like, I don't want Tox, I don't want Botox or Dysport, I don't want dermal filler or whatnot, we can talk about rebuilding a foundation within their skin
Of their own collagen.
which is amazing. And that, honestly, for all age groups, starting younger is a great way to be more preventative with all of this. So it's people say it's I'm too young or whatnot, but you have to think of it more as prevention, because if you look at your parents, you're probably gonna end up that way. So it's just a
Calling
different
my
way
mom
to
on
put it.
FaceTime.
I know.
What do you have here? What do I need to get done?
Smile.
Oh, that's funny. So you guys see male and female.
Correct.
How many do you see more males than you do females? Do you have a harder time talking to males versus females? I know I just asked 3 different questions, but go.
So being a part of Michigan Institute of Urology and, having their backing in regard to sexual wellness. We've been very heavy on sexual wellness, which is amazing, because I think for all of us, that's one thing that we take pride in, because we're helping someone like just kind of get their, feel better about themselves, their lives, and all of the above. So as of right now, like we are like, a lot of men are coming to us and they're like, I didn't know you can do this. I didn't know there was an option. I didn't know, I had another chance at, with erections and stuff. So I think right now we're seeing a lot of men come through the door and whatnot. So it's been really
that's
good.
The thing. They don't know.
And you have to education.
Our biggest thing is education. Yeah.
Okay.
Oh, yeah.
Are they scared when they come in? Do you think they're apprehensive? Like
Yes
they're
and no.
nervous?
We see everyone from so many backgrounds.
Okay.
A lot of our men who have gone through the ringer with prostate cancer, they are ready and open to talk about it. And then we see the other end of the spectrum too, where maybe this is their first time even opening up about having ED or something, to that extent. So we see it all, but everyone always walks out a lot more comfortable than they walk in. So.
Yeah. Oh, well, that's good. That's the whole point, right?
Right. Yes.
And that's why you guys are there.
Yes, correct.
So, Melia, I'm going to center this question around you.
All right.
So we've talked a lot about both men and women and focuses. And, being a woman myself, there's a lot of focus on men and men's sexual health and wellness and, men's ED and men's incontinence. And we don't really talk that much about women's. Why do you think that is?
So I think there's a lot of things going on without getting like super political or anything.
Oh, that's
like
okay.
That. But
it's 2024.
Yeah, right. So I think in general, women haven't really been invited to the conversation in a lot of ways in healthcare. So for a long time, there weren't female healthcare providers. For so long, up until recently, most of the drug trials didn't include women. Women were not considered reliable historians. Like we would go to the doctor and the doctor would tell you what was going on. There wasn't a lot of listening. There wasn't a lot of room for conversations. So I think in general, the conversation was centered around men in a lot of ways. And so I think that's just why we haven't. I'm excited because I think now that conversation is opening up, and that's like one of our big goals at Redeem. And so hopefully we'll just continue to see changes and movement in the right direction.
Yeah, absolutely.
It's just a taboo subject.
Right, right.
Everyone's going through it. No one wants to talk about it though, but like once it's kind of brought up, they'll listen a little bit more. Even like if you're going out with your friends. This is how, so a lot of people are like, how can I help like get the word out about Redeem? And I'm like, you know what, I want you to, like when you're at like a dinner with your friends, sit down and just be like, hey, listen, I heard about this place called Redeem and this is what they do. And then all of a sudden everyone's eyes perk up and they're like, well, what do you mean they do that? So it's everyone is going through it. They may not voice it, but there's always something, or they know someone, and they just like Melia said, our goal is to like make people comfortable with it, aware of it, and just come in and talk to us, and we'll just talk, and figure something out. So
you guys are here to help.
We're here to help.
Cool.
Yep.
Again, Melia, I'm going to ask you. What advice would you give, or what questions do you think a client patient should ask if they're coming to get aesthetic procedures or any type of procedure done by you guys for the first time and they're nervous or they just don't know?
Right. I think even before the questions, I think with respect to any type of healthcare, I think finding a provider that you trust, and obviously someone who's educated, that they have the right credentialing and whatever. But I think it's really important, and we underestimate how powerful it is to have someone that you can actually sit and talk to and have these meaningful conversations, regardless if it's aesthetics, sexual wellness, whatever. Looking for a provider that you just can trust and you really feel like, okay, they'll create a space for me to have an open conversation. With respect to aesthetics, specifically safety protocols, someone who understands the risks. Can you think of anything?
I think like even just spending time with them, like even through a consultation, because there's some people that it's like a revolving door. They're in, they're out, they're in, they're out. But like we plan like time to like sit and talk, consultations. We figure out a whole game plan moving forward. Our patients never feel rushed. they feel comfortable, they'll talk to us, and we kind of, we educate them too, even about aesthetics. Like, why does this look like this and not like this and whatnot.
Right.
So it's just, giving them the time and whatnot to kind of voice their opinion.
Yeah.
Right.
And then us to educate a little bit more.
Yeah.
So they could come in seeking something and have like this whole plan to be like, oh, my whole life's going to change.
Correct.
Now. This is going to be
Majority
wonderful.
of the time, that's what happens.
Yes.
Right. Because their main concerns are not what we're seeing. We're seeing something different. So we explain why that it's different and what we can do to help that, which in turn is going to help the other thing that they first came in for.
Okay.
Because they might come in and be like, I have this line. Can you just fill this line? And you're like, well, actually, that line is a result of this happening and this happening. And so these are your options, and this is what we can do moving forward to like restore that balance without just like filling the face so it's really heavy in the front. Exactly.
Oh, that's funny. So, Courtney, you kind of touched on like when an individual comes in, you guys do a consultation, you get like a whole plan, a care plan, if you will. We used to talk about those in nursing because we're all nurses here, remember
Lots
those?
of care plans.
And that you guys get a lot of your patients from MIU, is that correct? So then, is any of this covered by insurance?
Unfortunately, it's not.
Okay. I mean, I didn't think so, but we have to ask.
It's all elective, but it is a medically necessary procedures for a lot, and we do offer. They are able to use HSA accounts.
Oh, cool. Okay.
So if that it helps lessen the burden. When they first come in or first talk, they're going to talk to our front desk coordinator, Allison, and she's going to walk them through everything. She's going to be able to tell them, as far as the consultation goes, like what to expect, and she'll talk about pricing, what we offer, and we do help a little bit with like payment plans for them too, to break it up so it's not such a big burden all up front. Yeah. So it is an expensive journey, but in the end, everyone is very happy with their results, and they're investing in themselves at this point. So.
It's about quality of life.
Correct.
It's just like a gym membership.
Yeah, we say that all the time. Yeah, sexual wellness is a huge part of your overall wellness. So like you're really investing into like yourself as an individual. So,
Well, I think a lot of people can identify with that.
Yeah, absolutely.
Well, that's awesome.
Yeah, absolutely.
All right. So I know I've kept you ladies, but I still have a couple more questions. And this is to any one of you.
Yeah.
You see a lot of patients. You help a lot of people.
Yes.
Can you share a success story?
I'm going to leave that to Maddie.
So I've seen so many, and I don't want to get into too much detail, but
please don't.
Right. But
please do.
I think some of our favorite success stories are, just hearing from our prostate cancer patients who, have this extensive history like we talked about, and just being able to impact this sector of their life that they thought was maybe they were never going to see again is huge. And the person they leave our clinic is a completely different person than that walked in. And it's affecting all sectors of life, right? It's your relationships, it's your self-esteem, it's all of these things. So yes, we're helping with erectile dysfunction, but we're helping with like life as a whole too. Interpersonal relationships are huge for a lot of people too. So yeah, I think that's been one of the greatest things to see, especially.
Yeah, absolutely.
It's rewarding in general, just to see someone smile, walk out of our clinic. So that's the best part about it.
That's so great. Well, I'm gonna have to come, so I can be smiling without the lines, though, right? So honestly, I don't know of another Redeem or anything like it here in Michigan. I think you guys are the first and maybe only. I'm going to say that. Please don't Google me, anyone. But this has come up quickly.
Yeah.
And what do you guys see for the future? Not just for Redeem, but for like the whole scope of sexual wellness, which no one knew what that was 5 years ago.
There are a lot of a lot of people doing sexual wellness procedures out there, but they are not urologically trained the way we are, and backed by the Michigan Institute of Urology. So in general, we take pride in that as a whole, as a team, and there's only there's so many things that we're going to be offering and bringing in, and I think in the next couple months we're actually looking into hormone replacement therapy with BioT. And I think also some type of pelvic floor procedures and whatnot too, to help with different types of incontinence. So there are so many things that we want to make just a very well-rounded approach for when someone comes in. We have it all there for them. So yeah. It's going to be exciting. We're super excited.
Yeah.
Yeah,
That's
so
gonna be
I mean, we've
awesome.
only been open since November, but I mean, it's going great. And being in like, you know, Birmingham area, like we're pretty much very local to everyone. So we're kind of in the middle. So.
Right by Woodward, so easy
Everywhere.
on, easy off.
Everywhere, yeah.
Okay,
Yeah,
great.
absolutely.
Oh, thank you. Ladies, thank you so much for joining us
Thank you.
today.
Thank
It's a
you.
lot of great information. Now I'm going to go get Botox. Thank you for joining us today on AgeWise Health. I'm your host, Maggie Jess. If you have any questions about today's episode, please feel free to call us at 248-288-2270. Stay safe and healthy.